you for joining our daily media briefing. We're going to let everyone get settled. Give it 2 minutes for everybody just to connect to audio. And I will make sure that everyone has a sense of who our guests are today. I still see a couple of people connecting. Rob and Tracy. And we'll go ahead and kick off our media briefing. So again, we welcome and thank you to everyone. It is important to us to be transparent and visible, and to that end, we have several experts who are with us today. We have Jeffrey Flax, President and CEO, and we're going to kick it off in just a moment, but I also want to make sure to introduce Dr. Ulysses Wu, the Chief Epidemiologist. We have Keith Grant, the Senior, let me make sure to put folks on mute, our Senior Infection Prevention Specialist for Hartford HealthCare. We have Audrey Silver, who is a manager in the Hartford Hospital Emergency Department, and Dr. Sharon Kiley, our Chief Wellness Officer. So we have a plethora of experts today that we do want to make sure that you get a chance to talk to all of them, and I'm going to have Jeff Flax kick it off. Jeff, take it away.
Thank you. Good morning, and thank you everyone for joining us today. This is a time for caution, not confusion, not a time for panic. Many ways I describe it as we need to weather the storm. And that's what our organization and health systems like us in Connecticut are doing in this moment. I have enormous gratitude for all of our colleagues, working in healthcare today. I mean, this is just but another example of the extraordinary dedication, discretionary efforts, that are demonstrated each and every day throughout so many different moments of people rising to the occasion to care for our communities. And we're doing it under very difficult circumstances in difficult times. This is a fluid situation. And what's so crucial is we remain agile. Each and every day, new facts emerge, changing sets of circumstances. And we need to have the agility to continue to adjust accordingly and to make the decisions that are necessary in this moment with the best information we have now. And at the same point, to continue to adjust accordingly as each day goes forward. And then sometimes even throughout any given day. In this moment, we have just over 600 Hartford HealthCare colleagues who are out of work, who are quarantining, and who are COVID positive. We have just over 425 COVID positive patients across our health system. And when we look at that number, that's about the peak number that we had in April 2020. But at the same time, it's very different because the people we're caring for today, it's under very different circumstances. There's significantly less people who are in critical care, thankfully. We have many different interventions medically and through different pharmaceuticals available to us today that we did not have then. And most importantly, we have such a significant portion of our population vaccinated and often boosted. So today, when we look at our patient population, 38% of our inpatients are vaccinated, but only 7 patients who are within our hospitals have received their booster. And within our ICUs, only 3% of the patients who are caring for in our ICUs, and certainly Dr. Wu, Keith Grant, can speak. Really critical impact that both recent vaccination and booster shots have had in protecting people. We continue to make decisions each and every day. Our visitor guidelines today is that we have maintained 1 visitor each day for the people that we're caring for, and that's a decision that we're thrilled that we've been able to keep intact up to this point. But it's something we evaluate each day, and to the extent that we would need to suspend that if it became a necessity, we would continue to reevaluate it each and every day. So as soon as possible, we would try to reinstate it. And that's really the notion of how I want to describe this as a fluid situation. Just like we have 600 some odd people out of work today who work within Hartford HealthCare, every day, some of those people are coming back into the organization, and every day there's a certain number of people who are leaving the organization, and we are constantly studying, kind of the inflow and outflow to maintain the current operations within the organization as we go forward. We've put exceptions in place, for patients with disabilities, people within labor and delivery, certainly compassionate visitation for people who are receiving end-of-life care. We have to continue to lead and be humanistic, and do everything possible to be safe, protect all the people we're caring for, protect all of our colleagues, and at the same time, ensure that we have advocates and that we have people helping and supporting the people we're caring for. We've been able to maintain principally all of our services up to this point. We continue to do all of our principally all of our surgeries, and that we're managing our surge planning. We have had a handful of patients each day need to cancel surgery because they are testing positive, or in a few instances, we've had the surgeons or the proceduralist physicians test positive. But it's been a fairly very small number of cancellations that have occurred. But these are the types of things that we're studying and looking at each and every day. But our ambition, again, is to ensure that we have as much access to care so that we can treat all people under all circumstances who need healthcare. And we're trying to use all of our capabilities, all of our ingenuity, all of our resources, so that we can care for as many people as possible. And certainly areas like heart attack care, stroke care, labor and delivery, trauma care. On a morning like today, where there was so much ice, on our roads, where we had more motor vehicle accidents and people fall, we're here, and we're caring for people, and we're doing everything possible that we can to care for the people under these circumstances. We're very fortunate. We've invested years ago and have developed one of the national leading centers, the Hartford HealthCare Care Logistics Center. So we have a center built in Newington, that has oversight and visibility and control of every bed within Hartford HealthCare, all of our resources within Hartford HealthCare, from ambulances to helicopters to beds to our environmental services teams, so that we can really manage where patients are. And we're able to move patients. So if we have one region within the state, one county, that we're seeing, the greater challenges, we're able to do load leveling and move patients to where we do have beds, or where we anticipate having beds, so that we can try to ensure that we can care for people, in each instance. So tracking bed availability and being able to maximize ways that we can decant the areas of the system that are most crowded or under most pressure allows us, continue to maintain our operations. From a testing standpoint, in the last 5 weeks within Hartford HealthCare, we've done 106,000 tests. We continue to set up new testing trailers, and we're expanding our hours and days of operation as we go forward. And these are being finalized as we speak. We have 4 new locations, one in Bridgeport at 2979 Main Street, which starts on January 7th, in Torrington, in the Memorial Park, which is 101 Litchfield Street. That starts on January 7th as well. And then ultimately it's going to be moving to the Charlotte Hungerford Hospital campus. In Willimantic and Wyndham Hospital, we start on January 10th. And in Norwich, within the Hartford HealthCare East region, at our support service facility, which is 11 Stott Avenue, in Norwich, we're going to be starting on January 10th. And then we have additional trailers that are where we don't have the date confirmed, but it'll be in the very near future, for Newington, in Bridgeport and Norwich, as well as in Meriden and New Britain. So we're continuing to expand our testing operations for the duration of this winter, and as far as we see necessary. And that information can be found on hartfordhealthcare.org/testing. And this is a crucial part of how we're able to manage caring and supporting people in this moment. Our urgent care centers are seeing approximately 2,000 people a day, and they are a essential part of the response in this moment. And again, the urgent care centers are like any part of our system, from a staffing standpoint, are managing each day, how and where they can support, their capabilities and service based on our ability to have the dynamics of managing, where our staff are able to be. And I just want to underscore the absolute criticality of the work that's being done by people working on the front lines of healthcare today. It's absolutely extraordinary. Difficult to find words to describe it. And people are stepping up. They're working more shifts. They're volunteering to work in new and different places. We're redeploying many people who work in administrative functions today to work within our hospitals and to do non-clinical work. We're redeploying clinicians who work in research, or clinicians who work in teaching and faculty positions or administrative roles, and redeploying those clinicians to work in the bedsides on our different units. So the amount of planning and agility and creativity has been critical, but most importantly, it's the willingness, of people working in healthcare in this moment to do this. We've been fast tracking all of our capabilities on how to hire and retain, more colleagues into our health system. Just this week, we had 400 new Hartford healthcare colleagues take part in our first orientation this first week of January. So we're so thrilled, to be bringing more people in. We have a task force that operates each and every day, who's focused on how to support our staff. You'll hear today from Dr. Sharon Kiley, who's our Chief Wellness Officer, on all the efforts that are being in place to support people while there are shortages, that we have to work within in ways to be as supportive as we possibly can. So with that, happy to field these first questions, but also we are going to have Dr. Ulysses Wu and Keith speak to the very specific clinical issues. Audrey, as our manager, of our largest level 1 trauma center, can give tremendous perspective on what's happening on the front lines within our emergency departments. And certainly Dr. Sharon Kiley, who works across our entire organization with all of our colleagues on supporting them in all times, and in particular these moments of great distress, can give that perspective. So Rebecca, would you like me to start first with Jordan Fenster's question?
Yes, that's perfect. Jordan, if you could ask your first question, you can go off mute.
Thank you. I was going to ask about monoclonal antibodies, but Mr. Flax was talking about, how many hundreds of employees are out, redeploying people from more academic positions. You have people going into the emergency room to get COVID tested. There's no delay of care anymore. It does seem like hospital systems, particularly emergency rooms, are as overwhelmed were in March and April of 2020, but we're not seeing some of the same interventions. Like, I'm not hearing about COVID floors being reinstated, or I'm not, that you're not putting off elective surgeries, things like that. What's the difference now? If hospitalizations are as high as they were 2 years ago, why are you not taking the same strategies that you did in March and April of 2020?
Yeah, so let me first give some perspective, and then I'm going to ask both Dr. Ulysses Wu, Keith, and then Audrey Silver to give some perspective from the emergency department. But it's an important question you're asking, Jordan, and I think it really gets down to, first of all, we've been doing this for over 2 years, effectively, and we've continued to learn a tremendous amount to improve our procedures as we go forward, and most importantly, when you look back at where we were, back in April of 2020, where we didn't have a vaccine, where we didn't have things like monoclonal antibodies, where we didn't have the oral medications, that were just released, in the past several weeks. We didn't have the expertise within our ICUs, and how we were caring for people that we have developed, over the last several years through these learnings. We're significantly more advanced. But importantly, today, just at a very fundamental level, back in 2020, with the same number of patients in the hospital, we have really half of the number of people in critical care. So although we may have the same number of people we're caring for, the level of acuity, the level of intensity that we're experiencing for those people is different. So it does put different dynamics within the institution. But I want to just reinforce the fluidity of this situation. I mean, we're evaluating these considerations each and every day, and we have to, even to the extent we would have to, make in any geography that we work within, in any unit that we might have to make a decision to delay or suspend a service or care. Again, we would be reevaluating that decision each and every day on ensuring how quickly we could reinstate it safely. So that's the fluidity. But what we have to do is we have to do everything humanly possible to ensure that we're here, that we're able to safely care for people, and that we can keep in balance, the critical needs of the community, and not create delays in care, not to do everything possible to ensure that people who are getting screenings, who have cancer care, have no delays in care. So we're working so hard to do that. But let me ask Ulysses, Dr. Wu, to speak, certainly because clinically the innovations have been massively important on why we're in a different place today. And certainly Audrey can give some perspective, because the emergency departments, again, we want as many people to be getting tested outside of the emergency departments. The more people we can triage into these testing centers we're building and standing up, as I just described, the more and more people then we'll be able to care for in the emergency departments who are not being treated and released, but are being cared for conditions beyond testing. So please, Dr. Wu.
Yeah, no, I'm just going to reiterate everything that you have succinctly said. There are two major reasons why it is different now, Jordan. And number one is, what was the unknown? And remember, a lot was unknown back in March. We weren't even sure if we could touch our grocery carts back then without having to dehydrate. And then, yes, I did just make up that word. People, remember, were getting dressed on their front porches before they went into their house. There's a lot that is now known. That is number one. The second one, which I think Mr. Flax has certainly touched on, we're better. We're much better. We are better at doing this. We have better treatments. We have better testing. We have better modalities. I personally, myself, I see almost only COVID patients because I want to understand this disease. I want to make myself better. And that, I think that as well as I do, everybody else is doing it better. And so I think for those reasons alone, I think that's why we are better positioned to approach this. I will say there is still one big unknown. When is this all going to end? I don't know that. I can make projections, and I'm sure I'll probably get some questions on that. But that is our big unknown. But we do have a disease now that we know pretty well. And for those of you who have done these media briefings with me before, I love my NFL. And March 2020, that was training camp. That was August. We're week 17 and playoffs are going to start next week. So I think we're better. We're better as a machine. Connecticut is better. So that's, I guess, how I'm going to answer your question.
Thank you, Ulysses. And I just want to ask Audrey to speak to, and words can't describe the gratitude we have to people working in our emergency departments today. They're always there for us, 24 hours a day, 7 days a week. I mean, that's the definition of what they do, and the people working in our emergency departments are heroes. But in this moment, and certainly Audrey is representative of the exceptional human beings who are serving us. The emergency departments have when other services have, in the community, for whatever reason it may be, have made decisions out of necessity to close and so forth. The emergency department ultimately is there. And that is what it does. Please, Audrey.
Thank you for that, Jeff. We are definitely being challenged by this wave of the pandemic. We are experiencing extraordinary volumes, some of the highest in in the department history in the past week. But as discussed, our acuity has not necessarily gone up, and our admission rate has not really gone up to reflect an increase in acuity. So many of the patients that are coming in with this wave we're able to treat and then transition home safely. So agility was the perfect word to use. We're constantly reviewing our operations and optimizing how we use our space and how we care for patients so that we can manage these increased volumes. It has definitely been an all hands on deck effort, and the staff has just been incredible and resilient and creative, and it has really pushed us in new ways to look at our department and how we operate and how we can best serve the community when these things happen. So, you know, it's definitely a challenge, but it's making us better, and we're learning as we go. We've been learning for over a year and a half now at this point, but at the end of the day, I couldn't be prouder of the staff. They're just working really, really hard and doing the best that we can for our patients, and it's teaching us a lot for sure.
Audrey, just describe, I mean, how you've extended into new clinical care areas. You know,
We
so
have,
you had to open new units in places that didn't exist before.
yes, we have a trailer that was built outside of the department that is now named Silver Pod to match our other color pods in the department. No relation to my last name. But we have used that initially for COVID patients in the beginning of the pandemic, and now we've used it for this increased volume of COVID patients coming in. And, you know, it's something that we didn't think we'd have this space all this time later, but we're really lucky that we do, because it was a space we were able to custom design to manage what we thought would be really, really high volumes this time last year, but we're still seeing that this year. So we're using that space. We have an observation unit that opened within perfect time last spring. We are using that for observation patients, but sometimes with fluctuations in the census there, we're able to use those rooms to manage some of this volume. Our urgent care type area we're using as well, and adapting operations to manage this volume. And it's just really, it's gotten us outside of our normal box and how we've done things forever in the certain spaces that we have. We've really been able to look at it and adapt and adjust and pivot to manage this. So we're lucky to have the spaces that we do and the support that we do.
And you know, in this crisis, that's what's so crucial. You have to be adaptive and agile. And this notion of being able to pivot quickly, you know, we start and adjust. And we also opened on the Hartford campus the new Bliss building, you know, just several months ago. And that has been crucial to this response, of which we've expanded into the Bliss building also. So, you know, we continue to do that. Please, next question, Kay.
Yes, thank you. What percentage of beds are occupied at Hartford HealthCare, and is there a projection for what that number might do in the coming weeks?
Keith or Ulysses, do you have that number?
I don't. I think for the critical care beds right now, we're below 60%. So we're hovering between 55 and 60%. As we stated before, we're not seeing the impact, which gratefully we're not seeing the impact that we saw a few months ago on our critical care spaces. Overall in the hospital system, I know Hartford Hospital is very close to capacity. But we're managing very, very well. As it stands, where projections are concerned, we, you know, if we base this on what we see projected for this disease process from an epidemiological perspective, I don't believe that our rate of change is going to decrease within the next week or two. I think we're going to continue to rise. So we imagine that, you know, the innovation that Audrey and her team and many teams across the system have implemented through the leadership of Jeff and many other leaders. I think we're going to have to continue to do that and collaborate very closely, not with just HHC, but other members across the state to make this happen. So, yeah.
Do you have a plan for what happens if you reach capacity?
Absolutely. So, you know, one of the reasons why this work is because we've been planning, and we've been planning before this, and we, you know, if you see our management of the pandemic in the beginning of this, we had a very clear message to the community in that we're going to be here. We're going to be here with messaging. We're going to be here with vaccines. We're going to be here with testing, and we're going to continue to care for our community. And do we have a plan if we get to a point when we're significantly over the 450 patients that we have currently? Yeah, absolutely. We have a plan in place to mitigate that when necessary.
Are you able to share what that plan is?
Yeah, we have a whole series of steps that we take to expand into different physical spaces and to create new beds effectively within our facility. And we have across the state with the Hartford Healthcare facilities, we have considerable opportunity to expand our beds as necessary. So we're not, I think from a bed perspective, based on what we can project in this moment, we think we're in good shape. The rate limiting factor that we have to continue to be extraordinarily mindful of is our capacity, to have our colleagues, in good health and able to staff and support our beds, which, is part of the equation that we have to be reassessing each and every day.
It looks like Pat Eaton-Robb from the Associated Press is up next.
Hey, thank you. Good morning. Could you discuss maybe, Dr. Wu, the supply of the new Pfizer and Merck treatment drugs and how you are using them? Are you triaging? How do you decide who gets this limited supply? And does vaccination status play a role in any of that?
Yes, and so all very good questions. Looking at the chat room, I think this is probably going to answer a lot of the questions in the chat room. So we here at Hartford Healthcare, we've actually developed a nice system. It's actually called the Covet Outpatient Triage Center. And part of this was the realization that trying to get these patients managed after the fact, and what do I mean by after the fact? That means in the hospital was going to put a strain on the system. And what we wanted, and it really wasn't best for the patients. So we wanted to really attack the patients when they're outside, when they're maybe first starting to feel ill, when our therapies may have the most benefit. So within the triage center, what we are doing is that we are triaging these patients and we are risk stratifying all of them to determine what should they get. Should they go to the ED? Should they get nothing? Should they get a monoclonal? Should they get one of these oral therapies? And so knowing that, to answer your question with the oral therapies, what is going on with that supply is limited at this point. I want to point out that HHC is doing our best to provide the ethical framework in terms of how to best distribute these medications and provide equity with it. But that being said, with limited quantities, we certainly have a risk stratification where things like Paxlovid and the Molnupiravir, which are the oral therapies, even though they are in short supply, we are making sure that they are being delivered to those who are at most risk. That's how we're triaging it. If they don't meet criteria for that, then we look at monoclonal therapy for them. And obviously, if they need to go to the ED, they need to go to the ED. But yes, we are risk stratifying them, but we are making sure that these medications are getting to people in the most equitable manner and also those who are at most risk.
And how does vaccination status factor into you assessing these patients and whether they should get these oral treatments or not?
So I think the most equitable manner was to not determine what vaccination status was, because vaccination status is dependent on a lot of different things. And there are people who have received quote unquote full vaccinations and their boosters, but remain immunocompromised, who may stand to benefit from a lot of these therapies. And I have to thank Dr. Kiley about this because she really guided us through this process. And she's been amazing with regards to this. But yes, vaccination status does not matter.
And some of the ways, Dr. Wu, you've said that to me, is that the sickest patients, that you do it by symptoms and how sick they are.
Well, so as an inpatient, we certainly stratify who is the most sick. But with regards to outpatient, it's very difficult to discern actually who is the most sick. So I think a take along those lines is really more who is at most risk to get sick. That's how we're stratifying it.
Very good,
Tracy O'Shaughnessy. Oh, I'm sorry, Jeff.
Tracy, please.
Thank you for doing this, Mr. Flax. I want to ask again about a critical point that you made, that despite the near peak hospitalizations that you are seeing, you have far fewer people in acute care in your ICUs. Now, I think you said that you have about 425 patients that you are treating now. Could you tell us how many of those patients are in ICU and how many need ventilation, and how that compares to last year or your peak in 2020?
Yeah, yep, happy to share that information with you. Keith, can you pull that data right off, probably off the computer right now?
Absolutely. So as of last night, I don't have today's data. We're getting that right now. We had about 61 patients that were in our ICUs getting treated. And from that 61 patient, we had 7 patients that were vented.
And that would have been, Tracy, about half of what we had in April of 2020. So I think the number at April 2020 would have been about 30, let's say. So
yep.
Slightly better than half.
Sir, I think you have mentioned, I think Dr. Wu mentioned recently that we need to start thinking about, and pardon me if I'm putting words into your mouth, doctor, but being fully vaccinated, meaning having the booster. This seems to jive with what you have said, Mr. Flax, about the people who are fully vaccinated and who are needing acute care. Far fewer of those, as I understand what you said, are people who have received boosters.
Yeah, so I can actually take a crack at that, Jeff, if you don't mind. So our current data, so we had a good opportunity of having some wonderful statistician to review our data on a very frequent basis. And as I stated, one of the things that we wanted to pay very close attention to is boosters and the impact it's having, but at the same time, be very mindful of where we are with the Omicron variant. In Connecticut, it's been trending very, very well in that we've been hovering about 40+% with Omicron. At this point, we believe that, you know, just by not having enough complete sequencing, we might be a little bit higher in Omicron than we believe. So Ulysses and myself are looking at a plus and minus some numbers. But based on that, we decide we should start looking at the impact on boosters. So as Mr. Flax stated before, we're at 413 patients. This is when we looked at this data. And at that point, we had 7 patients that were boosted in the institution. So of all the COVID positive patients that we're seeing, only 7 patients that were boosted. I think what's even more interesting for us was from the patients that are not just boosted, but patients that are 6 months within the vaccination timeframe, or if you look at your Johnson & Johnson, patients that are in the 2 months for your initial vaccine timeframe, there's only 22 patients. So if you think about a complete vaccine status or high impact or highest efficacy for a vaccine period, there's 29 patients of the 413 patients that were here that are theoretically fully vaccinated. And again, this speaks to the impact and the effect of the vaccine.
And how many of those fully vaccinated people are in ICUs? That's not a number I think I heard.
We are trending about, for within the 29, there's none of the patients that are in ICU are off that 29 group at this point.
In other words, none of the patients who are now in ICU have had their boosters.
At the point of when this data was reviewed, that's correct.
Last question, gentlemen, I promise. We see, when I look at the CDC data every day on Connecticut, we see rather stubborn numbers in terms of about 75% of the state being quote unquote fully vaccinated. About 40% are now have their boosters. So given what we are seeing and what you are reporting, why do you think there is not a bigger rush to have people get these vaccines and boosters?
So, well, a few things. You know, we've had many conversations. A huge part of Hartford HealthCare's initiative with this COVID-19 pandemic. You know, Rebecca and her team has done a wonderful job in trying to get education out. So we've appreciated that. The hesitancy around vaccine needs to be met by proper education. It also needs to be met by access. And I think Jeff and the entire team has done a wonderful job to ensure that there's access to a point where we would get to someone's house, pick them up and guide them through the process of getting vaccinated. So I think that's one thing we still need to appreciate, that that's still going on. So there's still a lot of people who are still getting vaccinated. Additionally, when you look at the number, the state number, there's 2 sets of numbers that and timeframes that we really need to appreciate. So there's individuals who are still not qualified for a booster. So there's still individuals, if you look at the time frame of Connecticut's getting vaccinated, so 50% of individuals were vaccinated at a certain period of time that still doesn't qualify for a COVID-19 booster. So it puts us in a very good position. Now, if the question is, do we still believe boosters are very important? We should be stressing it. I think based on this data that we're submitting, I would say absolutely. And it's something that not just Hartford HealthCare, but the entire health system across the country will continue to push. We need to get our boosters.
And I would add, you may have seen our holiday commercials promoting booster shots. We have an entire public campaign around promoting booster shots and vaccination, and we're continuing to use our mobile health teams that go out each and every day, 4 to 5 times different locations to deliver vaccine and booster. So we absolutely are both promoting it, educating with respect to it, and delivering vaccine and booster into the community as fast and as capably as we can.
Take the next question from Claire Bissett from the Day newspaper.
Hi, good morning. Thank you again for doing this. I'm going to get a little specific. I'm looking for a breakdown of situations at each hospital. Of course, our area is William W. Backus Hospital and Wyndham Hospital. So I'm looking for conditions at those places. And also we get complaints about the length of time that it's taking to get test results. At the Dodge Stadium in Norwich testing site, people are saying that it's taking several days to get a result. What's your situation with those things?
Speak to the specifics of
Sure, absolutely.
Yeah, I can give you, oh, sorry, go ahead.
I'll do the breakdown of the COVID positives in each hospital, and then testing we can talk about a little bit and our plan to expand capacity. So Backus Hospital has 38 positives, Charlotte Hungerford 36. Hartford Hospital right now has 169 positives. Mid-State Hospital has 44 positives, and St. Vincent Medical Center with 66. Well, and
Wyndham.
Yeah, HOCC as well has 70 positive COVID patients at this point in time. Natchog with 5 COVID positives. It's one of our centers as well. In regards to time,
Wyndham, I'm sorry, I didn't hear Wyndham.
Wyndham has 17.
Wyndham has 17, I'm sorry. And in regards to time for testing, so, you know, I think one of the compliments that we've given a lot to our community members in the state of Connecticut is we've always respected the science for the most part, and people go out and get testing. And I think the more and more appreciation we have to how contagious this disease is, there's a lot of people who said, listen, I was around someone that is now positive and I will go out and get tested. We've also have people who are getting tested because, you know, I have a family member who is high risk, and if I'm going anywhere around them, I want to make sure I'm safe. And I think, so we are seeing a significant increase in testing itself. And, you know, we've continued to maintain capacity, and we've continued to commit to expand our capacity and capabilities for testing. And that's something that we're doing. However, with that increase, what we will see, what we've experienced indeed, is some return times or turnaround time for testing results. So we'll continue to work within the state, within our capacity, expanding our capacity to ensure that those times are even shorter and shorter as time go by. But again, it's an attestation of the fact that Connecticut and the citizens are doing the right thing. They're going out and they're getting tested, and that's, you know, that Audrey and her team has done a wonderful job in helping in maintaining that and delivering testing, and in expanding the capacity is something that we intend to keep doing.
And beyond the numbers of patients, COVID patients at each hospital, what is the condition at Backus and some of the regional hospitals? Are you full? Are you using expanded space, temporary space for patients? And what's the ICU situation?
Yeah, I could probably answer that. So, you know, our total available beds is probably about 2,000, and we have about 1,700 that are occupied across the system at this point. With regards to Backus, we maintain probably above 10% in terms of available beds at this point. So And Keith gave you the COVID numbers. I didn't know if you needed any other specific numbers for any of the other hospitals.
Do you want to talk briefly, because we do get questions about this, but as part of the surge planning, that on a typical day you have, let's say, 12 beds in an ICU at a specific hospital at any given moment, but with a surge plan, you have the plan to grow that to 20, like Audrey was talking about with the trailer. Do you want to talk about that? And again, the expansion, the contraction, Jeff was talking about, sometimes we'll have to take nurses from Hartford to bring them to St. V's. The similar thing is happening. It is this fluid dynamic at any given moment and constantly changing.
Well, that's how we just normally operate. You know, what you just described. I mean, these are things we would normally do during a peak flu season. You know, we always have expansion and the ability to contract, and we always deploy people to where they're needed most, or move patients to where they need the highest and best level of care. So, you know, these are capabilities that we normally use. You know, the situation today, you know, is exacerbating, you know, some of those issues, because it's under, you know, more pressure than you might have under, you know, routine circumstances. But we have to keep evaluating this. That's why the fluidity of it is we evaluate at each shift, you know, and we're constantly making adjustments accordingly. And that's, you know, even as I said earlier, and I think this is important to note, even if we made any given decision today on something, you know, like as an example, we've had to put certain restrictions around visitation so that we could, you know, have one person a day, you know, being admitted to see, you know, our people who are inpatients. As soon as we could safely move back to our regular visitation process, we will. And then to the extent we may have to move back to this level, because if the situation dictates it, we'll do that. You know, we just have to keep adjusting accordingly as we go forward, you know, and keeping safety at the forefront of every decision we make.
Jeff, just to tack on to that, Audrey, when you and I spoke, you say it so eloquently that, you know, we've been through this before. And the first time we went through the peak, we didn't have anything to go by. This time we do have something to go by. Can you talk a little bit more about what we've learned the first time and how you've applied it to this most recent surge? I think the way you say it is so precise.
Absolutely. Obviously, there were a lot of unknowns in the beginning, and there was a lot to learn, but we all learned as a team. And so I think it's often second nature for us at this point. We're able to quickly identify these patients that we need to rule out for COVID, quickly work on isolating them, now quickly work on testing them. And the whole team, it's just become a part of our normal practice to incorporate this, to put the isolation precautions up so that the appropriate PPE is worn, to, you know, prepare to do proning or different methods of treatment for this patient, and the new medications that we've learned about and started administering. So really, it's just become a part of our daily life in the ED amongst all the other things that we treat and see, and it's just expanded our practice. So despite the higher numbers of patients coming in that we're ruling out for COVID, it doesn't necessarily adjust how we're treating patients. It more makes us look at our operations and how we can optimize our space just to manage the volumes.
Alex, please.
Yeah, you guys have covered some of this, but I just want, if possible, more specifics about this surge planning, you know, creating new spaces and moving people around. I mean, like at a time when the hospital is full of not only COVID patients, but also non-COVID patients, where are there just big open spaces in the hospital that can be turned into ICUs? Are we talking about, you know, auxiliary units in the parking lot like we saw last year, or what does this look like?
My office is a pretty decent space. So no, but Alex, remember, the primary purpose for our system is to serve our community. We have space. It's repurposing space, and we'll figure that's 100%. We're ready to figure that out. It's figured out. It's written in a plan. There's quite a lot of process that's written to respond to different levels as needed. And I think our colleagues have given us an excellent opportunity to innovate, and they've managed well. And people like Audrey and her team has done a wonderful job to deal with expanding the resources that they currently have. But we're ready from every level of leadership and every level of our colleague support to expand. So space itself, based on the real estate that Hartford HealthCare occupies, we're well positioned to expand. It's really not much of what our concern is. Our concern still remains to ensure that enough Connecticut citizens are going out and doing the right thing and getting vaccinated, and ensuring that Audrey and her team are getting support, and Sharon's getting her message across to ensure that all colleagues are getting supported. But space expansion isn't, I'll be honest with you, it isn't the thing that keeps us up at night right now.
Can you talk?
Maybe my question.
To that end, though, to help Alex's, but what I think where Alex is going, if Keith and you and Dr. Wu and Jeff can talk about the movement to outpatient, that in a perfect world, how you're treating people outside of the hospital and really elevating that is also part of the surge planning. Can you delve into that?
Yeah, absolutely. And one of the things that we see more even with this variant, just looking at the data from the UK and South Africa, the treatments seem to be less need for critical care, acute care within the hospital system, which is a good thing. The other thing is, what we had an opportunity to do is explore our technology capabilities during this pandemic. So getting providers on a video chat with their patients very quickly, we've expanded that technology significantly. So it gives us that opportunity for expansion. Additionally, the actual treatment protocols that are now available, so the ability to use an actual therapeutic and treat a patient outside the hospital, that's expanded our overall capacity significantly. So every patient that we are able to treat outside of the hospital is a bed that we're able to save in the hospital. Rebecca, thanks for bringing that up. That's a good point.
Yeah, the ingenuity, of our organization, we're using our virtual care, our digital care significantly, and doing a significant amount of our visits through video care today, which allows us to expand not only kind of access, but even hours of service and days of the week. We're using home care, very differently. So these are all, the learnings that we've had throughout this crisis, and our mechanisms we have to ensure that we can safely care for the community.
And I have one more kind of quick question. A colleague of mine asked me to ask about N95 masks for children. Some people have suggested kids in schools should be wearing N95 masks, but there's also talk they're really only meant for adults. Maybe someone can clarify who should be wearing N95 masks, and if children shouldn't, then how should they be covering their faces?
There's absolutely no study, there's no research, there's no data that supports there's a need for kids to wear N95 at this point in time. In fact, the study still supports your normal, procedural surgical mask being very, very effective against COVID-19, to include the current variant that is circulating, the Omicron variant. N95 is made for a specific population, and individuals that are wearing an N95 truly should be cleared medically to wear an N95. It does create some level of restriction on your breathing, and you should get some level of medical evaluation before you're utilizing an N95. There's a situation that I believe an N95 is very useful and should be used in the hospital system. We use it primarily for around ear cell generating procedure. We also utilize N95 for individuals that are COVID-19 positive and symptomatic in PUIs. But generally, especially not for kids, there's absolutely no data at this point that shows that there's a need to change what is being done in the schools for kids for respiratory protection. Definitely not an N95.
Eliza, please.
Thank you. Jeff, you had mentioned more than 600 employees currently out due to COVID. What percentage of total employees does that represent? And what are the conditions for returning to work?
So we have just over 30,000 colleagues within Hartford HealthCare. So 600 of 30,000 to give you some proportionality. And certainly Ulysses can speak to, or Keith, on our kind of return to work process that we manage.
So,
I can see Keith right now. So
yeah, we're across from each other. So I looked up to Ulysses to see if he's going to start with this.
Go ahead, Keith.
I don't want to say it's complicated. So Dr. Paul Anthony and his team has done a wonderful job in the colleague health department in ensuring that they're adhering to the CDC guidelines very carefully. And we've been maintaining that. So very close to the CDC guidelines, as in if someone is vaccinated, someone has a booster, that's a significant consideration as well. If someone has a specific level of risk of exposure, that's a consideration as well. And the timeframes for return is, again, if you have symptoms, even after that critical 10 days, then you still need to be properly evaluated before you can come back into the healthcare system. But so it is, according to CDC at this point in time, we're still very close in line with the CDC.
Thank you. I appreciate that. And I just had one more question for Audrey. Are you concerned about staff burnout right now?
I mean, this has definitely been a challenge, and staff has been working really hard and they get tired. But I think the camaraderie that we've built through this and the support for one another, and the staff has been jumping in to pick up extra shifts to support, and even on the floor, just the roles of staff, everyone's stretching what they do to be able to support one another. And we've really been focusing on how we can best support staff through this, especially with Dr. Kiley's department. So, I think nationally, healthcare workers are working really hard right now. And that's just the reality of our situation. But we got into this because we want to be able to help people. And despite this being one of the most challenging times probably that many of us have faced, I think we're just doing our best to take it in stride and really rely on each other and just get back to the reason of why we're here, which is just helping the patient and just working through that. And at the end of the day, we'll all be a better team for it when we're done with this.
We have to do so much to thank and support our staff, in these moments. It's absolutely crucial. And we can't do enough to figure out more ways to be more supportive. But I want to ask Dr. Sharon Kiley, who's our Chief Wellness Officer, who spends really, as a physician, her full time, addressing these efforts on behalf of our organization.
Thanks, Jeff. And, I want to say that we focused on the well-being of our workforce even before COVID at Hartford HealthCare. We're an innovator in this space. But what we learned in the first round of COVID was that people really needed emotional and physical support, and it worked best at the elbow. That was very effective and very appreciated. And in fact, we worked with Audrey's department on one of our pilot programs related to resiliency. And, they, of course, kicked it out of the park. I mean, it was unbelievable what they did with this project, but they checked in on every person every day. It was really, really remarkable. And as a result, I think what you see in her team is that teamwork. And so the things we've done is we've really tried to put well-being in the hands of our leaders and well-being in the hands of our colleagues. They're very competent. They know what needs to happen. And so we started to do things such as, let's get serious about what do we not have to do? And Jeff led this effort about what should we stop doing, educations, right, other requirements that we've been doing for a long time but not really looked at. And we've eliminated a number of hours of time that people could be spending doing other things. We started and launched a well-being index, and we basically put their well-being at the hands of our colleagues in an app, and they can test their well-being every single day. This week, we're sending a postcard to every colleague's home so that they, in the quiet of their home, can reflect on that with their family and see what do their family need, what do they need, what does their team need. We really never stop training our leaders in things like psychological first aid, because for Audrey and all of us, we go to our supervisor, we go to our leaders for support. And one thing I'm super excited about is we launched an app early in COVID, and we have over 20,000 people who have downloaded the Hartford HealthCare Wellbeing app. And we're going to be relaunching that in the coming week with a local Hartford company. And we're very excited about that. And we're also going to be bringing carts, well-being carts, to all of our units, because we know that's where people need, they can't leave their unit, they're too busy. So we're going where people need us. we're listening, and we'll get through this. We got through it before when we knew even less. And all the people that I work with are just extraordinary. Couldn't do this alone, ever.
Really grateful for everything Dr. Kiley has helped bring to this organization. And I just want to mention the task force that Sharon referred to. Back in late November, we established a task force. And effectively, the goal of the task force was to try to eliminate anything we can within the organization that people who work here experience, so that we can make people's jobs easier and allow them to do the things that are most important, just care for people. So if we can suspend something, delay something, eliminate something to help make people's lives easier who work here, every day we're filtering new ideas and new considerations up, and we call them just do it's, and we're making these decisions to try to make it better and easier. And it's every day we're getting better thoughts that come from all throughout the health system, and we just are taking quick actions. And again, that's part of crisis management. There's some of these things are regulatory type things that in normal circumstances, you have to do them, but in a crisis, you have to start questioning, should we be doing them now? So that's the type of thing we're doing in this task force. So please, Tracy.
Yes, can you hear me, Mr. Flax?
Yes.
Sir, you mentioned two things that I wanted to ask about. First, you said 600 people are out of your 30,000 employees. Is that out permanently or temporarily? And secondly, you said you're seeing what sounds like a dramatic increase in your urgent care centers, which are seeing 6,000 patients a day. How many do they usually see, sir?
Yeah, so I'll answer that in reverse order. So we're seeing about 2,000 a day in our urgent care centers, not 6,000.
Normally.
So about today it's about 2,000. We'll Tracy get you the specific number. It's up considerably in terms of our urgent care centers. They're operating at near peak capacity. So at 2,000, those are very high, extremely high numbers for us. But we'll get you what our rate of increase has been over the last month. The question on the 600 people, so today we have 600 people, but what's important to note, and this gets to the fluidity of the situation, every day some of those 600 people come back to work because they meet their 7-day requirement and they're not testing positive any longer, and they come back to work, a certain number of people. And every day there's a certain number of people who are continuing to test positive or had an exposure and they're leaving. And what we have to do is be constantly assessing, our within that number, is the number growing and is it trending upward or downward? And we evaluate that number each and every day, multiple times a day, to try to be, so we can forecast, the number of people who will be available and able to work in their different capacities versus new people, who are going out for that 7 to 10 day time period. So, we have a very focused effort on it, and it's really critical because we have to, make one of our clearly our great vulnerabilities, right, is the number of people who are impacted, who work within Hartford HealthCare in these critical clinical care positions, their capacity to be here versus, being impacted by the virus.
Thank you, sir.
Any other questions? We have been on for a full hour. I know that it has gone quickly. Any questions? And I know Jeff would probably love to share some closing thoughts.
Well, I would just thank you for your attention today. This really is such an important time for us to respect and appreciate the ingenuity, of everyone working in healthcare. The work that people are doing is nothing short of exceptional and amazing, and the dedication, the discretionary efforts, words can't express, all of our collective gratitude within our community. These are difficult times, and they're challenging times, and it certainly tests the mettle, of everyone working in healthcare. But we have to weather the storm. We have to continue to adjust constantly, reassess, keep learning, and do what's necessary, in the moment based on the circumstances that we're facing, and then constantly be reassessing, reevaluating the circumstances. So, I really believe, and I said this today, that this is a time for caution. It's not a time for confusion or panic. and we have to be able to use all of our capabilities and resources to serve the community now. And certainly in this very moment, where we're seeing, this exceptional rise in numbers of people who are testing positive in our community. It goes well beyond our hospitals. It's our physician offices, our home care capabilities, our ambulance companies, our, all of the work we do within our home care capabilities. It's galvanizing all of our resources, coordinating all of our capabilities, and doing everything possible to safely support the community. And we just have to keep adjusting and learning and doing whatever's within our capabilities in this moment. So thank you so much for joining us today, and very grateful, for your efforts of helping to communicate within our communities.